We save the great saphenous vein for sparing a potential vital graft and to have less recurrences and complications after the treatment of varicose veins. Despite bilateral varicose veins, 5 coronary bypass were 3 with the left saphenous vein. Now, severe left claudication for popliteal artery occlusion, right saphenous vein available for a possible left below the knee bypass. The great saphenous vein is still the best material for arterial bypass, especially below the knee. Here, 3 studies and meta-analysis that confirmed it, but with many others. The great saphenous vein, when harvested with the no-touch technique, results is equivalent to internal thoracic artery. Homologous cold stored stripped great saphenous vein from varicose patients are less efficient than autologous as below-knee bypasses. Ultrasound studies document that varicose veins are limited to accessory saphenous vein. Great saphenous vein conduits identified by ultrasonography are available in limbs with varicose vein disease. Thanks to the CHIVA strategy, may the architecture of great saphenous vein sparing make it suitable as graft for bypasses. From Roberto Del Frate. Post-CHIVA histological specimen showed a perfect histological vein structure in all the veins with a normal bean mode appearance, better than a normal great saphenous vein as the consequence of the increased level of the internal pressure before the CHIVA treatment, similar to the well-known arterialization of vein grafts. Here, the saphenous vein, histological, and here, echographic. We save the vein also to reduce the recurrence and complications. The last meta-analysis shows that CHIVA seemed to have superior clinical benefits on long-term efficacy for treating varicose veins. However, the conclusion still needs additional trials for supporting this evidence, but up to now, CHIVA is better in terms of recurrence and complications. So, evident to preserve the great saphenous vein for a potential arterial bypass. According to this study, endovenous ablation doesn't mean safer. Why? Endovenous ablation has gained high acceptance worldwide, but the risks tend to be overlooked. Despite a very low complication rate, mortality has been reported. The complications found in mode represent only a fraction of the majority of the practitioners are not aware of this database. Further investigation by a large national registry is warranted to better define the real magnitude of endovenous ablation complications. informed consent is a real issue. President of the French National Ethics Committee wrote me explicitly warn patients of the loss of chance of bypass surgery before any destruction. The chief of cardiac surgery wrote me the great saphenous vein must be preserved as potential coronary graft. The chief of vascular surgery wrote me the great saphenous vein must be preserved as potential peripheral arterial graft. As varicose veins are usually benign, conservative treatments to spare the great saphenous vein as potential life-saving arterial bypass are proposed. 1. Elastic stockings may be sufficient. CHIVA is required for aesthetic trophic pain concerns. Evidence-based medicine information of the patient. CHIVA treatment is superior to endovenous ablation and surgical ablation in terms of pain, aesthetics, recurrence, and cost, and preserve the great saphenous veins, but requires in-depth knowledge of new concepts in venous hemodynamics, echocolor Doppler assessment, and CHIVA operating techniques. Ethics and law. Informed consent must include evidence-based medicine data. Consent must be free, knowing and informed, and can be revoked at any time. In the event of an intervention without consent, the doctor, regardless of the outcome of the intervention, may face claims for damages and, in certain cases, even criminal liability. This is Hippocratic oath and law.